to be with you today. That was a great panel, and we're going to continue the discussion around AI and big data and all that fun stuff. But we're also going to talk about the human side, as in, what does this mean for patients, for consumers? It can be very scary to the average person. We're all steeped in this industry and have a lot more information than some. So how are we going to make sure that patients feel safe, that they can trust the services and solutions that are leveraging big data, and make sure that the data is accurate and that we can really achieve the outcomes that we're all looking to achieve. So I'm joined here by 5 amazing health transformers. Each of these folks are leading companies that are leveraging data in really interesting ways. Some are building sort of the AI solutions of the future, and really achieving great impact in different ways. So I'm going to allow them to introduce themselves. If you could please introduce yourself, your moonshot, mission and vision, and what you're doing and how it's different. Shireen?
Okay. All right. So my name is Shireen Abdullah. I'm the founder of Yumlish, and we're on a mission to scale nutrition literacy. So our quick use case is someone who is at the doctor's office, they get a chronic condition diagnosis, and the doctor tells them, you know what you can do? Just start eating healthy. Great. Thank you for that, that great piece of advice. What do I do with that? We are the solution that answers that question.
Wow, that's super cool. Hey everyone, I'm Chris Turner. I lead the team at HealthBook Plus, and we help people own their health by leveraging data and AI to help people get insights so they understand what their next best health action should be.
Hi everyone, I'm Elianna. I'm the co-founder and CEO at Modern Ritual Health. At Modern Ritual Health, our mission is to fix the broken way that we are managing, diagnosing, and treating skin disease. You can think back to the last time you had a primary care appointment. Maybe you had a mole, a rash that came up, and then you're told it's a 6-month wait to get into your dermatology provider. That's just simply unacceptable. And our mission and what we are already doing today is ensuring that's less than 1 day for your care plan, management, and results.
That's great. Thank you. So my name's Meena Sandhu. I'm the Chief Revenue Officer for Careteam Technologies. And our mission is to fix the inefficiencies and drive better patient outcomes. We're all about patient success. So Careteam is a care plan-based care coordination platform for complex chronic conditions. We're really that point of contact. We're that hub that connects the entire ecosystem around the patient, and we're multi-comorbidity. So in America, 50 million adult Americans have 3 or more conditions. 30 million have 4 or more conditions. We connect the entire ecosystem, the allied care, the specialists, the primary, the personal caregivers, all into one care plan so that patients have better outcomes. Thank you.
Wow, that's awesome. I'm Mark Goettling, co-founder and CEO of BodiMetrics, or Circle.Health. Our health moonshot, or our whole goal in life, is to address health equity in 2 profound ways. One, we have the only FDA-cleared smart ring on the market that accurately collects blood oximetry across all skin tones. For 40 years, Black, brown skinned people have been misdiagnosed during COVID. Hundreds of thousands of people died or were misdiagnosed. We've solved that problem. Our labeling with the FDA proves that our device addresses that. And secondly, we extend care geographically and economically because we make remote patient monitoring available anytime, anywhere in a cost-effective way across our Ring app and cloud platform and analytics.
I absolutely love that you just brought up health equity because I think that's one of the biggest opportunities when it comes to collecting these massive amounts of data and layering on generative AI and analytics in general. We have a unique problem here in the United States. We're a massive country. We've got a lot of care deserts, and we've got a lot of rural populations and low-income populations that are just not getting the care they need, not seeing the specialists they need. So there's a lot of reason to be optimistic about these populations. So Shireen, why don't you start and kick off and tell us a little bit about the work you're doing and how you're leveraging the amount of data that you're using to impact underserved communities.
Absolutely. The first part of it is starting with understanding what data is really necessary. I think there's also this thing of where we're sort of just want to collect all sorts of data. What are we collecting it for? Like, let's just first answer that question. So we try to collect like the most basic information that we need from an individual. For instance, someone comes to us and we're acquiring users from the doctor's office. We don't collect any more than their name, their email, and phone number. And that's how we start the relationship. We understand deeply that we need to create trust with our participants who come onto our platform. We want them to feel okay with sharing their information with us. And so we build that trust. We provide nutrition programs that are culturally affirming, that is not only in their language, but is adapted for their culture. And through that, we're able to then extract data. And then they're able to share data with us without us having to hunt down that data from them. And then we also collect the basic data that we need to show them improvements. If you share this with us, you get to see X, right? Telling them why we need that data from them as well. So those are some of the values that we've incorporated into the system that we've created.
I love that so much. There's no better way to build trust than to speak with someone in their language and show that you respect and understand their culture. So I just love the approach that you take so much. Chris, how about you?
So I'll share a little story. So we've given our platform to several Medicaid providers, and one of their patients, who's a member of ours, is a 36-year-old guy, big, tall guy, strong, and he works the land, but he had this pelvic pain. Went to the doctors, went to the emergency room, and they diagnosed him with prostatitis. Well, the pain got worse. Nobody could figure out what it was, so they ultimately started giving him a bunch of opioids. And long story short, 9 emergency room visits, multiple PCP visits, 3 of those emergency room visits by ambulance, and they still haven't fixed the problem. So he went to our platform, entered his information and how he was feeling, some of the issues that he had, and our instant health check in about 5 minutes said that it's most likely a kidney issue. And so next time he went to the emergency room, he shared those results with the clinicians. And they came back, did a pelvic MRI, and identified that his kidney was twice the size of the other kidney because he had a blockage in the urethra, which they totally just dismissed, A, because he was Medicaid, and B, because they thought he was just an opioid addict trying to get more drugs.
Wow. And that is just one anecdote. Can you imagine multiply that by,
Exactly.
hundreds of thousands of people that's happening to all the time. So that's incredible. And Elianna, I know that serving the underserved is sort of the reason that you all were born, and tell us about it.
So growing up, I like to say I grew up in a very healthcare household, which if you have, that can be a lot. But to my benefit, my father's a primary care doctor, and my mother, who is the co-founder in my company, has been a dermatologist for the last 30 years. And I saw this really beautiful thing happening in my home where my mom would talk to my dad about the patients, and they would get to collaborate together, this really organic relationship among providers. But in today's environment, we're so stressed, and specialty appointments are so hard. And across the US, the majority of dermatologists do not accept Medicaid patients. And we hear this across the board. It's not just Medicaid, it's in rural populations, it's really across the board. And so when we started our company, we wanted to say, is this a problem for our nucleus of a family, or is this happening across the US? And so we looked at the data sets and saw that the fact is most societies and communities in the United States do not have access to a dermatologist, period, regardless of what environment that you're sitting in. And so our mission really, truly was to create this doctor next door for the primary care provider so that way they can get back to focusing on their patient care, and that we can provide a better experience for the patient who otherwise would never have gotten to a dermatologist in the first place.
Amazing. I love it. Meena, I know Careteam has been focused on this since day one, so let's hear about that.
Yeah, I mean, we're really a platform built around human-centered design, and the social determinants of health are something we think about strongly in the development of our product. And, really, if I look at the platform and you look at the predictive capabilities, you look at the population health functions that can be incorporated, language. I mean, I'm educated, I have access to resources. Our CEO is also a chief medical officer. I have access to all this information, and healthcare is still hard. It's still a challenge. Everybody here is informed and has access, and we still have challenges. So what is it like for a new immigrant? What is it like for somebody who's not educated, who's doing shift work, who doesn't have access? We want to be a platform that makes life easier for all of those individuals, and especially cloud-based platforms, and allowing more care at home, allowing personal caregiving teams, sons, daughters, other family members to join the patient's care plan really makes a big difference in the outcomes that they're going to experience. So the nature of Careteam is of diversity, inclusivity, using and leveraging predictive capabilities, and ensuring that everybody has access to the same quality of care.
Fantastic. And Mark, you touched on this a bit in your intro, but I just want to reiterate how the amazing work you're doing, that your ring is measuring very accurately oximetry for Black and brown skin tones, which is, one of those it's about damn time kind of moments. But congratulations, and can you tell us more about your work around health equity?
So personally, I think care begins with clinically valid data. So whether AI, contextualization engines, specialization, personalization, if you got bad data to start with, it makes all those things harder. So our core is to collect that clinically valid data in a way that makes compliance, engagement easy. Eliminate 5 devices, put 1 device on your finger. Anyone can do it. It's cost effective, it's intuitive. And by connecting that data and then contextualizing it, right, make it actionable and deliver it to the health systems is kind of key to the future. And whether that's telemedicine, virtual care, RPM, chronic care management, it goes on and on. CROs with subjects, consumers, it really doesn't matter. Employee care, we enable all of those things to happen. And just a quick story. We've been in the Veterans Administration for 5 years, finally commercializing it with them. But in pilots in, the spinal cord injured and ALS vets, and they need oxygen therapy. So and most of them live over 3 hours from a VA center. So now someone in a wheelchair, a vet, can get monitored, have their oxygen titrated remotely, and never have to go to a VA facility. So some of the
Amazing.
use cases.
Thank you. So shifting gear a little bit, talking about where we are in terms of, as I said in the beginning, the average person. The average person, let's start with in America. My litmus test here is my parents know what ChatGPT is. So they're I think that they've even tried it. So they're in their 70s, they're smart people, but the big data and AI are being consumerized finally. It's not just for the tech industry. So have you seen a difference in terms of the average patient or consumer's willingness to share their data? Have you seen any shifts there over the last year or two? Anyone want to raise their hand and take that?
Yeah, happy to jump into that. I think you end up with 2 extremes. There's the patients that are excited by the technology, excited by AI and ChatGPT, and they're willing to share more. And there's those that are getting more fearful of it. And I think we're at a stage now where, especially as health technology companies, all my peers here can relate to this, the onus is on us to educate our patients, educate our consumers, and due diligence. on everything privacy and security related. You know, we're a platform built around privacy by patient, so we really empower the patient to make the decision as to who gets to see what information when. And from, you know, the clinical perspective, you also touch on automation when it comes to ChatGPT and AI. And there's a fine balance of the right amount of automation. You know, most clinicians still need to be able to personalize and customize for their patients. So we like to say customizable by clinician and personalizable by patient. You still need that available to you in care. We don't just, you know, we're not all in self-driving cars yet, right? So it's the same thing for healthcare and automation and using tools like ChatGPT.
Yeah, I would just jump in and say our experiences for personal health, health engagement with your provider, family member, caregiver, they're very open. Where people start to pull back is where they feel there could be a discrimination in that data. So think insurers, payers, employers, where they don't necessarily want you to know everything about their health because they're fearful of discrimination. So,
I'll just add one more comment to that. I think for us reflecting, I find it that once we've established that trust, what we were talking about earlier, once we've established that trust with our participants, they want to overshare, even things that we're not asking them. And it's such a, you know, when we're talking about healthcare, once someone is comfortable telling you, and we're, of course, in the nutrition space, once someone is comfortable telling you what they're eating, it leads to a bunch of other things. Oh, did you know, my son did this. He got great, good grades in school. It's like, okay, good to know. Nothing to do with what we're doing, but thank you for sharing that. But those are the types of things we start hearing. Now, the piece around that is that once that trust is triggered, you have to, we here on this panel, own that responsibility to be able to protect what is being shared, right? So there is this onus that is then on us. So we have to be very careful in terms of scaling data and using data that we're collecting in order to scale, but then also balancing with what is truly needed to help us scale in that direction.
Thanks, Shireen. And, thinking about helping patients and consumers feel that trust, I think one of the things that has long really irked me in healthcare is the fact that we don't feel like we necessarily own our own data. Our data is just out there. It's in a million siloed databases. And when you think about your financial data, for example, it's very clear that is your personal information. And there are all these protections and processes and systems set up to ensure that. So, even in this time of blockchain, I'm thinking about, artists, et cetera, and generative AI suing because their work is being taken and leveraged and recreated, et cetera. So there's kind of a Pandora's box that can be opened here. And Chris, you had some interesting ideas when we were chatting earlier around data ownership and what that could potentially look like in the future to empower consumers and patients. Do you want to share some of that?
Sure. So at HealthBook Plus, that's what we're really trying to do is build a repository where people could put all of their health-related data. And I don't think people realize, but there's a lot of data sets that don't seem that they could be health predictive, but they are. Like socioeconomic data, for instance, is something that can give us a lot of great information without having to make an integration into an electronic health record. But having the ability to take and compile everything from genetics to if you have a wearable or smart device or remote patient monitoring, claims data, electronic health record data, all in one place, and then being able to aggregate it and make it in a useful fashion, we really believe is going to help solve a lot of the healthcare issues we have today.
Anyone have anything else to add on that one?
I'll just add really quickly, I think a big theme with Meena and Shireen and across the panel has been around the onus on us to really set the standards for care. And for our industry at Modern Ritual, data can be very abstract. And so for us, it's de-identified images. And back to earlier, when we talk about the standard of care today and a lack of trust, we know that a lot of historical models on de-identified images of skin conditions have not included a very diverse population. And so as we think about this problem, we take a very strong stance that yes, we are working to build a more diverse data set of de-identified images on all skin types, but that we have to set ourselves to a really high standard of care that starts with our 2Cs. It's a little corny, but we're healthcare. It's communication with patients, communication with our providers, because we are B2B, and consent. And that we can't just be like a cookie that exists on all of the firewalls that we all just click through mindlessly, but that we have to be so clear with our providers and with our patients about what we are doing, how they can access, and that they won't be going through 6 layers of subscription firewall to cancel and get that back.
We need some innovation needs to come in to get rid of those. Do you accept these cookies processes? But that's a whole nother
Amen.
Topic. What I'm thinking ahead, and I'm kind of an eternal optimist. So when I think about AI, I think mainly about the positive sides, although obviously there are dangers and we have to proceed with caution. Something that I think is just a really exciting opportunity to extend care is how can we get to the point where something like ChatGPT or a generative AI tool is as good as a clinician? So it actually becomes a doctor that can be the first line of defense for care. And I know, Chris, this is something your company has thought about a lot. What do you think it'll take to get to that point?
A lot. I think one of the biggest challenges is ChatGPT is really pretty good. And I'm going to say for some conditions, maybe better than a doctor. But the challenge is once you put that information to ChatGPT, the whole internet now knows what health issue you individually were trying to figure out. So that's a big problem. So what we feel is that it's going to take several steps to get there. So first you have to have the data set and health history of an individual. Then you combine that with the AI and predictive analytics and inference engines that can give a possible list of conditions. And then out of that, you're probably going to need to go get some FDA approval to make that even better and use models that are only sitting on a single platform in order to get now a preliminary diagnosis that can be checked by clinicians and then attached with treatment plans. And so that clinician can then look at it and say yes or no. And then once that data is compiled from there and the generative AI or the different AI engines can now do as good of a job as a clinician, maybe for low-level type things, then it might be worthwhile going to the FDA to get approval to be that clinician of the future that's AI-driven for very low-level type conditions.
And of course, a lot of trust would have to be built up before any of that could happen, because we have a little bit of grace for doctors who make errors, right? Because they're only human, but a machine cannot be wrong. We're not going to be okay with that. So a lot of progress needs to be made there first. Well, I love that you all are fellow health transformers, and at StartUp Health, we're really focused on breaking down silos and fostering collaboration. And I'm just sitting here thinking, you're all collecting different types of data. You're all doing great work, and wouldn't you be stronger together? So how are you thinking about collaborating with other organizations and opening up beyond kind of the data that you're collecting? Anyone want to start on that one?
Hey, I'll jump in. So Mark and I are neighbors over in the StartUp Health section over there. And what he's doing is so cool. And on our roadmap next is an API gateway to connect with all kinds of different really amazing point solutions that are doing a really great job. And Mark's is amazing. So we hope to make a connection.
Absolutely.
See? So that we can integrate all that data in a single place.
Yeah, so I'm sorry.
No, go ahead.
Side of dovetailing on that is we built our platform to be extensible. So we're willing to integrate at the machine layer, so Bluetooth device to app, at the SDK, at the app layer, cloud APIs, use our analytics, use our clinical data, use our cloud. At the end of the day, we're like 3M. We don't make it, we make it better. So we're all about helping make that happen. As far as data on its own, personally, I think every individual should own their health data. That should be secure, blockchained, And if someone's making a dime off your data, my data, I should get a fractional piece of it. So I'd like to see democratization of health data, period. We own it. We only share when it should be shared, who it should be shared with, and we should get a piece of the pie.
And I was just going to add to, when we talk about partnership, obviously there's strength in partnership, and it also plays into interoperability. And if I look at the landscape of healthcare technology, you have these, large, gigantic organizations, the EMRs that sit above everything else. And then you have a million point solutions and hardware devices. And Careteam, as an organization, as a platform, we're really trying to step into the middle so that we can have numerous integrations and APIs into our platform, and then we connect with the EMR. So in addition to uniting the ecosystem around the patient, we do the same thing with our technology partners, and we love expanding the technologies we work with. And I think an opportunity that exists is universities everywhere do research. There's a lot of medical research done, and there isn't enough leveraging all these amazing startup technologies to support the data, the capturing of data, the storing of data, the dissemination of that data. So more and more research really should be aligned with all these startup technologies as well. It's a big opportunity out there.
Thank you, Meena. We only have a few minutes left, and these are clearly companies to watch. Keep tracking these founders and these amazing companies, and just give us a quick, each of you, preview for what's to come. What do you envision in your, waving a magic wand for what you hope to achieve in the next 2 to 3 years with your company, and what impact that could have?
Yeah, so for me, my big vision is this model that we're creating, which is really Netflix for nutrition, but being able to provide that at a very accessible level. So part of what we do is low tech in these Medicaid populations we currently work in. And so my big vision around it is that nutrition literacy is provided at a broader scale across federally qualified health centers, across our community clinics, and someone is just not told to eat healthy and go and figure it out on their own, because it's not that easy. It's very complicated. And so my big vision on it is to scale nutrition literacy across underserved communities.
I absolutely love that.
Cool. Yeah, and for us, it's building more AI models and deploying those on the data, getting more data, but then adding to that API Health Hub I was talking about and finding companies to partner with, but then also to merge or acquire along the journey. So I know there's a lot of companies that raised a bunch of money in 2021 that access to capital is difficult right now. So, if you're one of those companies you think it'd fit in our platform, would love to talk to you.
Nice.
Over the next 5 years at Modern Ritual, we foresee ourselves that you, as a patient, whether you're in Alabama, whether you are in the densest city in New York, you have rapid access to the dermatologic care that you need whenever you need it. And that combined with we're having more robust, diverse data sets of imagery that can help to solve for the most critical oncology treatments, for alopecia treatments, where right now we are lacking so much so today.
That's great. For Careteam, over the next couple of years, right now we have over 16,000 active patients on our platform. I want to see us with 100,000 active patients, 100,000 improved lives, better outcomes, giving patients control of their health care, giving providers more time to do what they want to do, which is actually treat their patients and not be bogged down in administrative work, and just looking to do more partnerships and collaborations and keep growing and keep coming back here to meet with the rest of you. Thank you.
I guess we have two primary goals for the future. One is almost immediate. We have to address the issue with dark pigmented individuals not getting the proper care. Every day, tomorrow, if I were sitting up here, someone's died because they've been misdiagnosed. That just can't happen in our society. And 45-ish% of the world population has darker pigmented skin. longer term, I know this will scare everyone in the founders room. We actually believe that we can non-invasively measure blood glucose from the level of the data and acuity of our data in our smart ring. So that's on the horizon as well.
Amazing. That was also a fantastic segue because our next panel is type 1 diabetes focused. So thank you for that, Mark. Thank you, all of you. Thank you for joining us today, for all the hard work you're doing to advance your health moonshots and make this world a better place for people. So I truly am grateful for you, and thanks for listening, and have a great day, everyone.
Thank you.